just so that you're not hanging and pulling with your head, okay?
Okay.
So come on down
I guess the only other thing
and blow out.
Stephen Loomis is on month 5.
So one hand on your chest.
And his struggle with COVID-19 symptoms is still going.
I am hanging in there.
He's dealing with everything from a troubling heart arrhythmia to brain fog and constant fatigue.
It's changed our lives, all of our lives, considerably.
There are a dozen medical terms or nicknames for people with symptoms a month or more after infections, but it's often called long COVID, and those with it label themselves long haulers.
I think it's probably more common than we realize.
Dr. Juan Cabrera is part of UT Southwestern's new post-COVID clinic, one of just a handful in the state. It's where Loomis is doing rehab and the demand is growing.
The people that were really looking for the most help were the ones that were having the quote unquote milder cases of COVID.
More than a year into the pandemic, much about long COVID remains unknown. The World Health Organization estimates 10% of COVID cases still have symptoms 12 weeks later. So consider that in the US, there are about 33 million reported COVID cases.
So there's a strong effort to do something for these individuals. It's just a lot harder to find a program that is big enough and organized enough to actually market itself as a COVID program.
Cabrera says fatigue and brain fog are the most common lingering issues, along with loss of taste.
It doesn't take much for me I walk around the grocery store and I've got to sit down.
Loomis isn't just a patient. He's a provider, typically working as a physician assistant at an urgent care. In April of last year, he traveled to New York City.
It seemed like the right thing to do.
Helping the effort against the virus.
It was chaos. It was organized as we could make it. Everybody was dying.
But he never tested positive until December.
Well, I had a pretty good dose of denial going on at the time.
He was sick, but wasn't hospitalized until about a month later, when fading symptoms suddenly came back strong.
The shortness of breath got so bad, and the fatigue, and my staff of medical assistants were like, they looked concerned.
He's been unable to work, but the symptoms and the bills haven't stopped.
We made the rent money this month. Yeah, this month it just barely.
One of the many questions doctors still can't answer is how long it lasts.
And I'm very honest with my patients that I do not expect this to be forever, but I do not know when it's going to end for each and every one of them.
And it's become clear children can be long haulers too.
I don't think anyone knows the true long effects of COVID disease on children.
Suzanne Whitworth is the head of infectious diseases at Cook Children's. A growing number of kids are showing up with different lingering symptoms, keeping them out of school and sports. She says parents should watch for signs.
I'm too tired to go out and play with my friends. I'm taking naps when I didn't previously do that. I think when the parents see and hear things that make them think things are not right, they need to call their doctor.
After 3 months on the wait list, Loomis is a month into treatment. There is no known cure for long COVID, but surveys have shown about a third who get vaccinated have seen symptoms reduced. Whitmore says it's at least a way for parents and children to be protected.
We have to get vaccinated to make this all go away. We have to get the population vaccinated, or we will be dealing with this for a long time.
Stephen Loomis is on month 5.
There.
Symptoms haven't faded, but neither has his motivation as a healthcare worker, a husband, and a father.
I think what keeps me going is that I want to return to that role of provider, or I have to.
In Plano, I'm William Joy.